Yes. We are going to start the session. Take your pencils, papers, notebooks, and everything. Thunderbolts. Part C. Listening. Yes. Yeah. Get ready, all of you. We are moving forward. Now, here, this is from the official site. Part B. Yeah. Part B. This is listening. Part B. We are going to take care of this listening part B. Okay. Right. Yes. Listening part B. Okay. Listening part B. Listening part B, no, listening part C, right?
Yes, sir.
Doing part C, sorry. Doing part C, not part B, it's part C. Part C. Okay. Listening part C. This is Thunderbolts. Listening test part C. Yeah. Questions 31. Okay. Listening test. Okay, this can be 7. Listening part C. 31 to 36. Official. Kaplan. Kaplan. Kaplan practicals. Practice. Kaplan practice. Yeah. Right. So Kaplan. Kaplan 13. Page number. Kaplan page 13. Yeah. Listening part C. Okay. So right. So Kepler 13. Yeah, get ready with this. So if you have Kepler, you can see. Otherwise, you can just okay. If you have already printed that one, it's okay. Otherwise, also no problem. No problem at all. Yes. Kepler page 13. And everything will be in only Telegram channel. Not all will be there in the yeah. So Kepler material. Kepler authentic official materials. Okay, this is not official. This is Kepler authentic, not OET official. It's Kepler authentic official materials. Yeah. So now coming to the question. Okay. Right. So this is. So let us take one. So listening test 7. I'll be listening C. Okay. Listening C. It's 1. Okay. Right. View. Slide master. THUNDER. Start. Right. Close. Yeah. So now, so try to not to miss this session. Okay, try not to. We are going very fast, and I'll explain you fast. Okay, this is a special session. Okay. Yes. Yeah. So this is the point here. I'll show you how to check for the materials also. Okay. I'll tell you how to check for the materials also. Okay. Right. Now this is the question. Go through this question. Go through this question. You hear a dentist discussing booking problems with her receptionist. You hear a dentist discussing booking problems with her receptionist. What has caused the problem? An error with the booking system, a double booked appointment, lack of communication. So now you can just go through these things. What caused the problem? Cause and effect. There's a problem. There's a problem. You hear a dentist discussing booking problems with a receptionist. What has caused the problem? Is it an error with the booking system? Or is it a double booked appointment? That means same appointment booked 2 times. Lack of communication. Communication problem. It was not communicated properly. So booking system error, double booked appointment, lack of communication. That's it. Yeah. So now you can see here, this is our Telegram channel. You can just to go and type there Kaplan audios. Finished. You'll get Kaplan audios. Finished. Then you go for a track. See, this is the material. Lot of materials are there here. Lot of materials are there here in this Telegram. Just to click on this search bar, yeah, lens, and then you will click here. What Kaplan, or you say Jason, Jahshan, Jason. Listening means listening. So finish. All Jason listening will come here. Okay, see Jason listening. Everything will come. Whatever you want will come here. Test number 20, test number 22, whatever it is there. Suggestion listening, PDF. Suggestion listening PDF. So that's it. Suggestion listening PDF. See here. Suggestion reading PDF. So everything you'll get there. Okay. So now what we want, Kaplan audios. Kaplan audios. Just type there and click anywhere. Kaplan audio files. Okay, see here, Kaplan audio files. Now you go there and what you do, which track you need to listen. So track 7. So we are going to play the track 7. For this one, we are going to play track 7 for these two questions. Track 7 for question number 1 and question number 2, it is track 7. So now first let us play this one. Okay. So first let us play this one. Right. So here it is, track 7.
You hear a dentist discussing booking problems with her receptionist. You hear a dentist discussing booking problems with her receptionist.
Hey Kieran, Mr. Lau just mentioned that he'd tried to reschedule his appointment yesterday, first online, and then when that didn't work, he called up. But apparently he couldn't reschedule. Any idea why?
I wasn't working yesterday, but let me check the notes. So, Lana left a note about the call. She says that Mr. Lau wanted to reschedule, but we didn't have any other appointments this week after 3 p.m., which is the only time he could make. He asked if he could make an appointment next week, but his procedure was marked on our system as urgent, so she had to make it in the same week. The system wouldn't have let her reschedule it any later. She wouldn't have had the authorization to change that. Still, she should have discussed this with you at lunch or at the end of the day, because then you could have decided whether it could have been postponed for a week.
Yeah. In his circumstance, it would have been fine to reschedule at a slightly later date. We should prevent something like this from happening again.
You're right. I'll talk to her about it tomorrow, and I'll send out an email to everyone else so that they're aware. You hear a doctor discussing chest x-ray information with a medical student.
Okay. So now you got the question. So this is Thunderbolt.
You hear a doctor discussing chest x-ray information with a medical student.
Thunderbolt 1. Okay. Right. Now 7, 6, 5, 4, 3, 2, 1. Submit your answer. Submit your answer, all of you. You can submit your answer here. Okay. So print a screen, full screen here. Okay. All right. Now let us take the audio. Kaplan audio track number 7. So we are forwarding the track here. Okay. Listen and answer the question, please. Okay. All right. Now here, okay. Yeah. So now let us give the answer here. So let us check the answer first. Let us check the answer first. So this is Jashan. So answers on which page? Answers on which page? Yeah, like 13. Yes. Listening part B. Yeah. So now let us see that part to test B. Track 5. Track 6. Now track 7. So right, track 7 is coming now. Yeah. So a lack of communication. One is C. A lack of communication. A lack of communication. Okay. Now let us take it here. So the answer is okay. So create poll. Okay. So Thunderbolt 1. So create poll. Thunderbolt 1. It's A, B, C. Who is more? Right. It's focus. It's facts. Facts means focus, attention, focus, attention, concentration, techniques, and strategies. Okay. Focus, attention, concentration, techniques, facts, strategies. So you have seen the answer is C, a lack of communication, right? A lack of communication. You have noticed there already, right? Yeah, a lack of communication. That's it. You can just click on that one. You can just click on that one. Okay. You can just click on this one, A, B, C. Okay. So copy post link. Yes. So update your scores, please. Update your scores, please. Update your scores, please. Redmi, is this Rajani? Redmi, type your name. Is it Rajani? Yes. So 3 people have given the answer. What about the others? Redmi. Redmi is who? Redmi. Yeah. Yeah. All of you write your first name and second name. First and second names. Names, please. This is attendance I'm taking. Yeah. Redmi is Anju Kumari. Is me Anju Kumari. Redmi, two Anjus are there or what? Already Anju Kumari is with Anju Kumari. So Redmi is also Anju Kumari. There's a name called Redmi. So is this Anju Kumari? Yeah, let me check. Hello, Redmi, unmute. Yeah, Redmi. Is this Anju Kumari or Akireddy Rajani? Redmi. Chat. Name, please. Yeah. Redmi 7 is me, Anju Kumari. Okay, Redmi 7 is you are coming with Anju. But there is another Redmi here. Okay. Chintu Jofin, welcome. Yeah, Sakina Ahmad, welcome. Those are new to this platform. Okay. So you have seen first answer. Okay. So we'll be discussing more of those things. I'll be explaining you more. Okay. I'll be explaining more why it is right and why it is wrong. So this is page number 25. Okay. Right. Then next one. Yeah, track 7. This is the next second question. Yeah. So second question. Yeah, second question here. So this is number 2. Okay. Number 2. Yeah. Okay. Yeah. Rajini Akiredi. Yeah, that's what I was asking for so long. Okay, Rajini Akiredi, I'm trying to contact you. You're not getting in touch with me. So for speaking session, I was calling you. Oh, Akiredi, and you did not even message me. No problem, but just at least message me when I call you. Okay. Yes. Kamaljit Kaur. Right. See, I know everyone by the names. Arshia Anju. Okay, right. Fine. So now second question we are going. So you hear a doctor, hear a doctor discussing chest X-ray information with the man. What is the doctor explaining? What is the doctor explaining? Yeah. Yes. Right. Yeah. Now here, this is the second question. You hear a doctor discussing chest X-ray information with a medical student. Go through this. Yeah. To go through this question. So you hear a doctor discussing chest X-ray information with a medical student. What is the doctor explaining? What is the doctor explaining? Okay. The order, the order for discussing results to the patient. So results, which results should be discussed with the patient? What is the order? First, what results? Next, what results? Next one, the information to include in patient notes. So order for discussing results to the patients. Chest X-ray is there. That results discussion with the patient. So the information to include in the patient notes, case notes, so that this is transferred to the other doctor or somebody else. So first one is patient is important. Second one is doctor is important. How to correctly examine the patient's condition. This is for the doctor who is examining. Okay. So first one is results. Second one is information. Third one is examination. First one is discussion. Second one is information. Okay. Or we can say patient notes. Right. First one is X-rays results. Second one is patient notes. Third one is examination. Third one is examination. Okay. So you have to focus on these three things. X-ray is taken. You hear a doctor discussing chest X-ray information with a medical student. So doctor with a medical student. So he is explaining the order for discussing results to the patients. Okay. So how to discuss with the patient, the order, the sequence, the hierarchy, which is first, which is second, which is third, like that order. The next one is the information to include in the patient notes. So which information should be included in the patient notes? So she is going discussing with the patient is the first one. Writing the patient notes is the second one. Examining the patient's condition is the third one. First one is discussion. Second one is providing information to the in the patient notes. That means case notes. Entering in the case notes. First one is discussing with the patient. Second one is entering the notes or including the notes in the patient notes. Third one is examining the patient. Correct examination or a diagnosis. You can say like that. Right. So Thunderbolt 2. Yeah. And the audio is here. Same audio. Second half. 2 questions. Right. Now let us see here. I'm going to play the audio now.
You hear a doctor? I'll talk to her about it tomorrow, and I'll send out an email to everyone else so that they're aware.
You hear a doctor discussing chest x-ray information with a medical student.
Hey, Dr. Yan, we've got the x-rays back for Mr. Regis in bed 8 from this morning.
Great. Can you document them in the notes?
Do you mind showing me how to write the interpretation properly?
Of course. Make sure you put the patient details. Full name, date of birth, patient number, and home address first. Then put the hospital and ward, date, and time. Make sure your name is on the document too. Include the indication for the x-ray like hemoptysis or dyspnea before documenting your interpretation. Now, I use a simple mnemonic to make sure I don't miss anything. A, B, C, D, E. Airway, trachea, carina, bronchi, and the hilar structures. Breathing, lung fields and pleura. Cardiac, heart size and heart borders. Diaphragm, position, shape, and costophrenic angles. Finally, everything else, the mediastinal contours, bones and tubes or devices. Make sure you document everything clearly using this system in the notes.
Yeah. So Thunderbolt 2. Yes. 7, 6, 5, 4, 3, 2, 1. Submit. Submit your answer. Very good. Very good. 8 students. Fat.
You hear an ENT surgeon talking to a colleague about cochlear implants.
Wow. One-sided. Wonderful. One-sided. Wonderful. So most of them have written B. Accurately send to everyone. Don't send to me personally. So all B. Okay, let us check whether you are right or wrong. Okay. So 23. Yeah. $24. Fine. So first one is C. Second answer is B. The information to include in patient notes. Yeah. So please update your scores. Please update scores. Yeah. 1 by 1 or 2 by 2. I'm going to give you a very special session today. Try to be available as much time as possible. Okay. Spend as much time as possible. I'll give you a lot of sessions today, especially the exam going students. Especially the exam going students. Yeah. Right. So the answer is B. Okay. All of you respond here. Okay. So what is that? Listen and answer the question, please. Okay. Right. Now, yeah. So create poll A, B, C. Yes. FACTS. Facts. Okay. Means what? Focus. Facts means focus. Number one, attention, comma, concentration, comma, techniques, and strategies. Yes, that's it. And the answer is, yeah. I want you to go here and click on the answer so that everyone will participate, know an idea. Copy, post a link. Yeah. Go and click here. See, only 3 people or 4 people have clicked on, 6 people have clicked on answer A. Okay, little above. So you go and check your answer. Na? Right. So go and check your answer here. Very good. These are obedient students. See, 2 students have answered. All attend like that one. It will be beneficial for you. Okay, we are going to learn many more things. I'll show you the secrets. If you attend this one, the next level I will take you. This is target B plus. This is target B plus. Then I'll target you to target A afterwards, 3. So, right. So, yeah. Question 1 and 2 are over. Now question number 3. Track 8 for question number, yeah. Yes. Yeah. So this is, yeah. So, yeah, this is Hifza Jailani, I think. Yeah, Kadian, welcome. Hifza Jailani. ILAN. Yeah, right. Very good. The strength is increasing. Invite your friends. No problem. Today you can invite your friends. Yeah. So I want to ask you, do you want to spend more time with me? Okay. To learn the tricks. To learn the tricks. Okay. Do you want to learn the tricks? Yeah, welcome, Kadian. Can you write your full name, first name, and second name? Can you write your first name and second name? How many of you? Dr. Swati, yes. Kamaljit, yes. Come on. Kadian, Rohit Kadian. Okay. Rohit Kadian. Thank you for giving me your name because I want to know my students' names. Yeah. So that's it. Ah. Tintu Jofin, very good. Welcome to the platform. Sakina Ahmad, welcome to the platform. Rohit Kadian, welcome to the platform. Yeah, all other students are regular students. Yeah, very good. So those students who did not submit your first name and second name, those who did not give the attendance, you can give now. So we are going to do as many sessions as possible. Today we'll blast C part, listening. Then we'll blast C part, reading. So those who are regular here, then only I will give you. So I'm writing the names of these people. Okay. Yes. So, yeah. Who is there? Dr. Swati, very good. Kamaljit, Dr. Arshia, yeah. Kiran Kaur. Kiran Kaur, write the names of all these students, okay? Them only will invite for the reading part, part C. Right. And write them in a notebook and send them to me. Thank you very much. Yeah. So, right. Now listen to this next, read this next question. Read this next question. Yeah, this is Thunderbolt. Thunderbolt 3. Yes, Thunderbolt 3. Now see, this is track number 8. Next one is track number 8. What is this? Track number 8. Okay, track 8. Not here. Track 8. Yeah, track 7. Track 8. Yeah, here it is. So this is Kaplan and this is track 8. Kaplan. So Kaplan is there. You just say Kaplan audios and track 1, 2, 3, 4, 5, 6, 7, 8. So lot of everything is there in the channel actually. Okay. So this is track 8. Okay. So track 8 and here listen and answer the question please. Okay. Now, yes. Go through this question. You hear an ENT surgeon talking to a colleague about cochlear implants. You hear an ENT, ear, nose, and throat surgeon talking to a colleague about cochlear implants. The surgeon is explaining that cochlear implants. Yeah, yes, cochlear implants. Okay, ears. The surgeon is explaining that cochlear implants. Okay, what do they do? What is their role? Cochlear implants, what do? They transmit voices or emit sounds or restore hearing in deaf people. So transmit voices more clearly. That means more clearly. Earlier not clear, here clear. So it is clearer, means clarification. Okay, clearer. That means earlier not clear, now more clear. Earlier clear, now more clear. Or clearer. Earlier clearer, now clearest. Better than before. That means improve the quality. Improve the quality. Second one is emit a variety of sounds into a microphone. Emit a variety of sounds into a microphone. Emit sounds. Transmit voices. Emit sounds into a microphone. Then restore hearing in deaf people. Restore hearing in deaf people. Yeah. So think about these things. First one is transmitting voices. Okay. Clarity. Here it is clarity. Then second one, emit into microphone. Into a microphone. Into a microphone. So here microphone. First one is clarification. Second one is microphone. Third one is restoration. Deaf can hear now. Deaf people can hear now. Okay. Those who cannot hear, they can hear. That's the point here. First one is can hear but not clear. So more clear or clearer. Second one is emit a variety sounds into a microphone, sounds into microphone. So microphone. The next one, third one is deaf people cannot hear, they can hear. Restoration. Restoration, that means deaf people can also hear now. Earlier cannot hear, but because of this they can hear. So first one is clarity, second one is microphone, third one is restoration. Okay, restoration of hearing, that's it. Yeah.
You hear an ENT surgeon talking to a colleague about cochlear implants.
We implant an electrode array which looks like several small wires made of a platinum iridium alloy into different regions of the cochlea. These metal wires conduct the electrical impulses generated from the microphone, which picks up sound from the environment and sends the signals to the electrode array through a transmitter. There's also a speech processor between the two that filters more important sounds so that the patient can hear people talking rather than other sounds.
Right, okay, so does this restore hearing to normal levels?
No. With the current technology, we're giving deaf people a good representation of sounds from the environment and help to understand speech. After surgery, patients undergo therapy to relearn the sense of hearing. Not everyone benefits from the device to the same extent.
Right.
You hear a GP talk about type 2 diabetes mellitus.
Yeah, Simiat, very good. Okay, so this is next one, Thunderbolt 3. Thunderbolt 3. Okay, 7, 6, 5, 4, 3, 2, 1, and submit your answer. All of you, submit your answer. Today's sessions are free, so invite as many friends as possible. Invite as many friends as possible. Today's sessions are totally free. You can invite as many friends as possible. If you think that this is the best platform, invite your friends. Send the link openly to any number of students. Send the link open. What is one side? Oh, so there is one C. All others are A. Yeah, there is one C. Okay, right. You can invite your friends. If you feel that this is a very wonderful platform for all your friends, so bring your friends here so that they also can learn. Okay, many things. Yes, invite your friends, as many as possible. Yes, Dr. Rani, I think this is. Okay, fine. Yes. Sorry if it's not Dr. Rani. I think you are Dr. Rani, so I changed it. If any changes there, you can tell me. Yeah. So, lot of sessions I'm going to give you for listening and reading today. Multiple sessions, multiple sessions. Already I have given 3 questions. This is the third one. Okay. Now let us see what is the right answer here. So, third answer we need. This is first answer. Okay. Second is B. Now third answer. Third answer is, so second answer. And third answer is A. Third answer is A. Update your scores. Update scores. Please, 3 by 3 or 2 by 3 or 1 by 3 or 1 by 1. How many you got? Or 0 by 3 or whatever you want to write, you can write. Yeah, thank you very much, Kiran. Thank you very much for the names, 15 names. Very good. This is why Simon sir likes Kiran very much. Yeah. Come on, all of you, submit your scores. Yeah. Submit your scores. I want to see. Make me proud by submitting your scores. Make me proud by submitting your scores. I'm not playing the fool here. I need your to see your progress. No, otherwise, what is the use? Huh? Yeah. So the fourth question next. Fourth question next. Yeah. In the meantime, you can invite your friends. Don't be selfish. Something is good means even the crows call their friends. Huh? Even the crows call their friends. If food is there, ants call their friends. If food is there. Okay, here something food is there for the OET aspirants. So why don't you call your friends? Don't be selfish. Okay, plenty of food is there for everyone. Okay. Yeah. Yes. So now this is the fourth question. So you can invite your friends as many as you want. Today is an open session and free session. Fourth question. Sure. So this is the question. Go through the question. Now I'm taking B plus level of session. Afterwards, I'll take you to A grade session. I'll explain you how to identify more further. So you hear a GP talk about diagnosing type 2 diabetes mellitus. You hear a GP talk about diagnosing type 2 diabetes mellitus. Why should a fasting plasma glucose test be booked in the morning? What's the reason? Cause and effect, reason. So it is booked. What is the reason for this booking? Booking is the effect. So what is the reason for this one? Okay. Why is it booked? Okay. So what is the reason behind it? Yeah. The patient will need to attend an 8-hour appointment. The patient will need to attend an 8-hour appointment. Okay. 8-hour appointment. That's why morning. Next one, the test will need to be carried out twice. The first one is duration. Second one is frequency. Third one is to allow the patient to eat during the day, permission. First one is appointment, duration, 8 hours. 8 hours. So the patient will need to attend an 8-hour appointment, 8 hours of duration. The test will need to be carried out twice. How many times? First one is how much time, how long. Second one is how many times, or the number of times, twice. Twice. Third one is to allow the patient to eat during the day, eating permission. Okay, eating permission. Now let us listen to the audio.
To the same extent.
Right.
Patients undergo therapy to relearn to understand speech. After surgery, patients undergo therapy to relearn the sense of hearing. Not everyone benefits from the device to the same extent.
Right.
Get ready.
You hear a GP talk about type 2 diabetes mellitus.
Hello, I'll be covering the diagnosis of type 2 diabetes mellitus. So there are 4 methods that we can use. The first is a fasting plasma glucose test. This is our preferred diagnostic test as it's easier to carry out, often more convenient, and costs us less than the other 3 tests. It helps to try and book these appointments in the morning, as the patient has to refrain from eating for at least 8 hours before they can take the test. Normal fasting blood glucose will be between 70 and 100 milligrams per deciliter. A value of over 126 milligrams per deciliter indicates a diagnosis of diabetes. Bear in mind that this test should be carried out twice to confirm a positive result. The second method we can use is to measure the average glycemic load over the past 3 months.
Yes. So, Thunderbolt 4. This is the 4th question for today. Yes, I'm counting down. When I count down and tell submit, then you can submit. Yes. 8, 7, 6, 5, 4, 3, 2, 1, and submit. I'm going to see how many students are answering. Yes. Ten students, 11. Yeah, very good. Now the number increased to 18. Very good. More students are participating. Yes. I told you, invite as many students as possible. The more number, the more interest I will have, and the more examples I'll give. Yes, 13 students have given the answer. Is that all, or is there anybody else who have to submit? Come on. So B and C, divided answers. C, B, C, B. Yeah, right. So anybody else? Yeah. So now let us see here. Yeah. So this is, sorry, I did not give the answer for this third one, right? Sorry. Yes, here is create poll, Thunderbolt 3, A, B, C. Okay, this is FACTS. Yes. So let us check the answer. What is the answer here? Okay. So 1C, right. 2B, 3 was A. Yeah, 3 was A. So those who have completed this answer, you can just go and click on this. Okay, you will know. So you ABC, just go there. This is third answer, not fourth answer. This third answer, previous answer. So whatever you have written, you can just click there. Check your previous answer in your notebook. Okay, at the end of the day, you write all the answers, take a photo and send me how many marks you got. I'll be encouraged to give more sessions if you are getting more benefit. And all of you attend this practice. If any day you miss, you can do like this one. If you miss the sessions, right? Yeah. So, sorry. Hi. Yeah. So fourth question now. So fourth question answer I'll give you now. So before that one, finish your third question answer. I forgot actually that one before. Sorry for that. So this is the fourth question. Full screen. Yeah. Very good. Thank you very much for answering. 7 students have submitted the answers there. Thunderbolt 4. Yes. Thunderbolt 4. And yes. So here listen and answer the question, please. Yeah. Fine. Now the answer, key for this one. I gave you the fourth answer. Fourth answer is here. Did you all submit the answer? Let me check. So you all submitted the answer for Thunderbolt 4. Yeah. Now let us check your answer. Thunderbolt 4 is C. Those who have given C, you can update your scores as full scores. Add one more mark. Update your scores, please. Yeah. Let me see. How many of you got good scores? Yeah. Very good. 1 also is okay. 2 also is okay. 3 also okay. 4 or what? Even if 0 also okay. Today we are getting 0. Tomorrow we'll get 1. Day after tomorrow we'll get 2. Next day 3. Next day 4. Full score we'll get at the end of the day. That's it. Yes. So, right. So we have seen this one. Now let us fill our this one here, Thunderbolt 4. Learn the style of how Grandmaster class works. Follow these things. Okay, A, B, C. Okay. Yeah. So what is the answer? Fourth one is C. Yes. So what you do is all of you just go and try to appreciate the style of this copy post link. You can click on there and you can click on here 1, 2, 3 ABC. Click on that one. Okay. Right. Yeah. Now we have completed 4 questions so far. Completed 4 questions so far. Yeah. Are you ready for 2 more questions? Are you ready for 2 more questions? If it is a yes or a no, type it out. Majority. Yeah, I have given you. Now you can listen there afterwards. No problem. You can listen here. It's already there. Okay, Siniat. Here it is already there. You can listen again. Afterwards, I'll explain in detail. So how many of you are yes? Just type. I should get at least. So out of 17, I should get at least 11 or 12 votes. Come on fast. Give a yes if you are interested. Otherwise, we'll stop. Okay. So next one is question number 5. Yeah, come on, give yes. So Sakina, Kamaljit, Rani, Viji, Anju, then Simiat, Akireddy, Arshia, Hibza, Jailani. 9 only. I need 2 more, at least 2 more. Yeah, right. Yeah, then Hafsa, Fatima, yeah, 1 more. Yes, next one is 5th question. 5th question. This is 1600. Okay. Yeah. Yeah. So question number 9, track number 9. So 4th one over. Yeah. Very good. Many students are saying yes. So we are moving forward. So, so out of you, how many of you are interested in a reading session later? Reading session later. I mean, in the evening. How many of you are interested in the reading session? Type your names, not yes, sir. Okay. Type your name. First name only enough. Okay. Those who are interested for reading. Yeah. Those who are interested for reading can type your names. All of you. Yeah. Very good. Very good. Yes. Right. So if you are telling, yeah, Kiran, just write these names. How many of them are there? So count them and write these names and send them to me. We'll call them for reading lecture in the evening. Okay, we'll call them for reading lecture in the evening. Yeah. Then next one. Yes. Right. Now we are seeing the 5th question. 5th question. Okay. Yeah, this is 5th question. Yeah. Yes. You know that we are going at a very rapid pace. Oh, yeah. Yes. So, This is the question. Yeah, get ready. You hear a dentist talking to a patient with a chipped tooth. You hear a dentist talking to a patient with a chipped tooth, dental problem. What does the patient want to know? He is asking for something. The patient wants to know something. How long the procedure will last means duration, length of the procedure, duration. When her next appointment will be scheduled, next appointment. Okay, what her different treatment options are? Treatment options. First one is duration of the procedure. Second one is following appointment or next appointment, schedule of the next appointment. Third one is different treatment options, surgery, medicine, or something else. Okay, different options. Okay, so first one is duration. How long, how much time? 1 hour, 2 hours, 3 hours. Second one is next appointment, when? Tomorrow, after 15 days, after 1 month, after a fortnight, after a week. What are different treatment options are? So surgery, medicine, okay, or plaster of Paris, something like that. Example I'm giving you. So what are the different options? This one or that one or that one. Okay. So try to focus on these three things: time, duration, next appointment. Third one is treatment options. Treatment options. Duration of the procedure, next appointment schedule, different treatment options. That's it. Focus on these points. Okay, this is given fourth. The next one is fifth. Yeah, 1 second. Print a screen. Full screen. Yeah. See, only 5 students have given the answer here. See, I told you, I requested you to write the answers here. But only 4, 6 people have given this point. Follow it up. So, Thunderbolt 5. Thunderbolt 5. Okay. Now, next one is, this is 8th one. Next one is track 9. So, how do you find out these things? Go click here and you will say Kaplan audios. Okay. Then you'll get Kaplan audio files. You can see track 1, track 2, track 3, track 4, track 5, track 6, track 7 finished, track 8 finished. Now we are going for track 9. Okay. Track 9. Yeah. So this is track 9. Yeah. So listen and answer the question, please. So now let us see. So we are going to listen track 9 and answer.
You hear a dentist talking to a patient with a chipped tooth.
So we've talked about different options, and it seems like a veneer would be the best treatment. Given the cost of the procedure, are you happy to go ahead?
It's quite expensive, but I definitely need to get it fixed. Will it stay put?
Veneers tend to need replacing every 10 to 15 years, so they are a long-term solution. It will certainly be more durable than composite bonding, and it will look more realistic too.
Oh, okay. Well, that's great. And is there anything I can do to extend their lifespan?
Well, you need to maintain good oral health. You know, brushing, flossing, regular checkups. You should avoid brushing your veneer too hard, as it could cause damage.
Okay.
You hear a podiatrist talking to a patient with fallen arches.
Yeah. So Thunderbolt 5. Thunderbolt 5. Yes. So submit your answer. 8, 7, 6, 5, 4, 3, 2, 1. Submit. Yeah, 11 students have answered. Still 4 students. Okay. Now let us check. So majority A. There are some C's also. There are some C's also. Okay, fine. Now let us just check. So yeah, number 1 is C, number 2 B, number 3 A, number 4 C, and number 5 is C. C is the right answer. Many students have lost it. Many students have lost it. I will tell you, I will explain you afterwards. Okay, I'll explain you afterwards. Now, first we are going to identify how difficult some questions are so that we can try to analyze. Okay, so I'll bring you in another step, that is A grade. Okay, so fine. So Sakina Ahmed, Anju Kumari, then Dr. Arshia. 3 of them got them right. Okay, so no problem. So we also can get it right. Only the thing is we have to be a little patient. That's it. Yeah. So 12. Next question. So we have seen this one where question number 5. Now we are going to question number 6. Okay. So now let us see here. Thunderbolt 5. So create pole A, B, C. Yeah. So what was the answer? We have corrected here. Yes. So it was C. C was the right answer. Okay. Now what you do is please go there and click on this answer so that we'll know how many have participated. So it will be encouraging to others. It will be encouraging to others. If you just go and tick there, it will be encouraging to others. Please do that. so that others are also encouraged. Yeah, next. Question number 6. Yeah, here it is. Question number 6. Yeah. Yeah. So we have the options. Yeah, there it is. Question number 6. There you go. It's okay. Don't worry. People don't have time. Okay, we have time. Those who have time, they can attend more. That's it. If you have a big stomach for learning, then definitely you can learn more. Those who don't want, let them go. No? We are least bothered about everyone. We are only bothered about those who are serious. Yeah. And it is already first. So those students who have to pay the fees, please clear it. Okay. You'll miss many sessions otherwise. Those who have dues, you can pay the fees and continue. Yeah, you hear a podiatrist talking to a patient with fallen arches. You hear a podiatrist talking to a patient with the fallen arches. The patient explains that his treatment. The patient explains that his treatment. Now, what is he talking about his treatment? Will need to continue for some more time. Continuation of the treatment. Second one has become too time consuming. This is unnecessary. This much time not needed. First one is need more time. Second one is time consuming, means waste of time. Waste of time. Then third one is not improving his condition. First one is need more time, requires time. So second one is unnecessary time wasted. Time wasted. First one is time necessary. Second one is waste of time. Third one is no improvement. No improvement. No improvement. First one is more time. Second one is unnecessary. Waste of time. Third one is no improvement. No improvement. Neutral. So first one is improvement. It needs more time. Means slow. Or he's thinking that it is okay. Second thing he's telling is become too time consuming. That means it's prolonged. Prolonged. Okay. Waste of time. Waste of time. Third one is not improving his condition. No improvement. So time, first one is time needed, positive. Second one is time unnecessary, negative. Third one is no improvement, neutral. First one is positive. Second one is negative. Third one is neutral, no improvement. Means no decline, no improvement. No, it's status quo. It's neutral. First one is positive. Second one is negative. Third one is neutral. So I hope you understand what I'm telling you here. So function print screen. So full screen. So fifth question. This is sixth question or seventh? Sixth question, right? So Thunderbolt 6. Yeah. Thunderbolt 6. Yes. Now, say 1 second half. Listen and answer the questions, please. Right. Now let us go to
Their lifespan.
Well, you need to maintain good oral and composite bonding, and it will look more realistic too.
Oh, okay. Well, that's great. And is there anything I can do to extend their lifespan?
Well, you need to maintain good oral health. You know, brushing, flossing, regular checkups. You should avoid brushing your veneer too hard, as it could cause damage.
Okay.
You hear a podiatrist talking to a patient with fallen arches.
So, you say you're experiencing foot pain. Are you wearing supportive shoes?
I'm wearing appropriate shoes, and I'm also wearing orthotics that should be helping, but I'm still experiencing pain in my feet. Sometimes they feel a bit numb too.
Right, okay. And you mentioned that you've been given some foot exercises to do?
Yeah, the physiotherapist I went to showed me those. At first I thought they were helping, but now I think I'm as bad as I've ever been. Is there anything else we can do?
yes. Now let us see here. Okay. So do not write until I ask you, please. So this is Thunderbolt 6. Thunderbolt 6. Yeah. Thunderbolt 6. Right? So, yes. Submit your scores. Submit your answer. 7, 6, 5, 4, 3, 2, 1, and submit. Submit your answers. Very good. 13 students. Very good. That's awesome. C, 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 C. Nobody B, nobody A. Wow. War is one-sided. War. Okay. One-sided. Good. Great. Great soldiers. Wonderful soldiers. So now let us check the answer whether it is right or wrong. Okay. Yes. So sixth one. All right. 1, 2, 3, 4, and then 5, 6. Sixth one is a C. Sixth one is C. So update scores, please. Update scores, please. 6 by 6 or 5 by 6 or whatever it is. Update your scores. Let me be happy that you are doing something. Okay, I need to know, right? So A, B, C. So Yes. So the answer is C. Yeah. Yes, previous answer, how many I have answered? Only 7. Okay, no problem. Now this is question number 6. Copy post link. Yeah. All of you can update your scores and go there and click on this one, ABC. Very good. 2 students already clicked. Okay, update your scores. So for those students who got less than 6 out of 6, you have to attend my sessions. Those who already got 6 out of 6, so that means you are excellent and you don't need to attend my next session for A grade. Okay, right. So I'm going to give you explanation why, what are the uses, what are synonyms and everything. All of you, write your scores, please. Yeah, now 6 questions completed. Okay, 6 questions completed. Do you want me to continue? Do you want me to continue? Yes or no? If you want me to continue, give me a yes. Okay, I need 3/4 of the students. Yes. Okay. Yeah. Yes. Why? 2. Simia. Very good. Come on. Fast, fast, fast. I don't have time. Okay. Yeah, I'm there whole day, but only if you're okay. Only if you're attending. Yeah. So, right. Yeah. Some students, something like 10 students have said yes. That's fine. So, all of you try to go and click on these options so that others will be encouraged. That's it. Next one. So, 7th question. Okay. Yeah. The 7th question. 7th, 8th, track number 10. Okay. So that is second set number 2. So 6 questions over. Okay. Part C. Yeah. Next. So 7th question. So that means extract 2. Extract 2. Okay. Extract 1, 6 questions over. Extract 2 we are going. Yeah, I'll explain the answers. I'll explain the answers. I have to take the script also afterwards. I'll explain you everything. No need to worry. Just first I'm checking where you stand. I'm checking where you people stand. Okay. So 7th question. Yeah. Yes, this is the 7th question. Okay. This is the 7th question. You hear a doctor talking to a patient in an emergency department. Emergency department. You hear a doctor talking to a patient in an emergency department. Emergency department. Remember that. Yeah. What is the doctor doing here actually? He is explaining how the patient will be treated. He is explaining how the patient will be treated. So is he explaining the patient? He is not explaining to the patient, he is explaining how the patient will be treated. But we don't know whether he is explaining to the patient. Okay, maybe he is explaining how the patient will be treated to as subordinate, maybe. Second one, reassuring the patient that she is not at risk. Here he is reassuring the patient, talking to the patient. First one is talking to the subordinate about the patient, maybe. Okay, or talking to the patient how the patient will be treated, that also maybe. Okay, then going over the cause of the patient's infection. So he's explaining the cause, why this infection happened. First one is treatment. Second one is no risk. So focusing on no risk. First one is focus on treatment. Second one is reassurance, not risk, no risk. Third one is cause of infection, cause of infection. So first one is treatment. Second one is risk. Third one is infection. First one is treatment. Second one is risk. Third one is infection. Once again, first one is treatment. Second one is risk. Third one is infection. Remember that. Focus on these three things. And the track number 10. Okay. Yes. Function, print screen, full screen. Yeah. Thank you. 9 students have written yes or no here. Ticked the box. Thank you very much. That is what I am very happy when you listen to me. Thunderbolts 7. Okay. Once you are very obedient, that means automatically you are moving to the positive side. That's it. The more people are obedient to the system, process, procedure. If the procedure is right, the result will be excellent. If the procedure is wrong, your result will be nonsense. That's all. So Thunderbolt 7. Yeah. Thunderbolt 7. And it is number 10, track number 10. Kaplan Audios, track number 10. So here is track number 10. Yeah. So listen and answer the questions, please. Okay. Now we are going to play the audio. So this is track number 10.
You hear a doctor talking to a patient in an emergency department.
Hello again. I'm Dr. Oliveira. I think we met earlier at the beginning of my shift. How are you doing now, Mrs. Jones?
I don't really know what's going on. I'm just hoping to find out what's wrong with me.
Okay, Mrs. Jones, I understand, and thank you for waiting. They've run the tests, and they think you've got a condition called pseudomembranous colitis. It's a long way of saying you've got an inflamed colon. You've been waiting so long here in A&E because you're going to need a side room because of the infection risk.
Oh dear. Okay, thank you for telling me. How long will it be till I get a room? And is it serious?
Well, at the moment, Mrs. James, we're operating on a one-in, one-out basis. But I do think that a side room will free up in the next few hours. The outlook is very good in most cases. We're going to give you antibiotics and fluids, but there is a small risk of the infection returning in the future.
You hear a medical student talking to a senior resident about assessing a patient.
Yeah. So, Thunderbolt 7. Yes. You can submit your answer. 7, 6, 5, 4, 3, 2, 1, and submit. submit your answers. Yes. So 9 students have responded. Okay. 1C, 2C, 3 Cs. 1, 2, 3 Cs. Okay. Remaining A's. Okay. Now let us see this answer. Right. So question number 7. Okay. Right. So 7th answer. 5, 6. 7 is A. 7 is A. 7 is A. So, right. Update scores, please. I'm telling please. So try to at least respect the word please. Okay. Update your score, please. Okay. So Thunderbolts 7, A, B, C. Okay. Yes. So the answer is A. 7th one is, the answer is A. Yeah. So you can just click on this, copy post link. Arshia Anjum, 7 out of 7. Anju Kumar is 7 out of 7. You don't need Simon sir. Why are you wasting your time here? Oh, Arshia. Oh, Dr. Arshia. Why do you want me? You go and practice your own. You don't need Simon sir. Unmute. Huh? Hello. Arshia doesn't want to unmute.
Yes, sir.
Okay.
Yes, sir. Yeah, good afternoon,
You
sir.
don't need me. Why are you wasting your time here? Go and prepare on your own. Go.
Sir, still the concepts are not clear. We are waiting for your answer.
Yeah, I'll
Your
explain.
your explanation, sir.
I will explain. Definitely, I'll explain.
Yeah,
Definitely, I'll
waiting for
explain.
that also.
I'm first
Thank you.
testing how students are doing. Okay,
Yeah,
I'm
sir,
just
thank you,
testing
sir.
you how
Thank you
you
so
people are
much.
doing so that I can give explanation. Nah? Okay, fine.
Thank you, sir.
So you can
Yes,
mute
sir.
back.
Yes, sir.
Right. So that is a 7th one. Yeah. Right. So next one, 8th question. 8th question is here. 8th question, iPhone. Who is iPhone? Can you please type your name, iPhone, first name and second name? iPhone. I cannot call you iPhone every time. Na? So type your first and second names, please. Okay. Type your first and second names, please. Yeah. Next, eighth question is here. Eighth question. I told you I'll take very fast. You understand now, I think. Too many questions I am taking. Oh. Yeah. Yeah. So this is question number 8. I go through these questions. Yes. You hear a medical student talking to a senior resident. You hear a medical student talking to a senior resident about assessing a patient. What is the senior resident doing? What is the senior resident doing? Teaching the student how to examine the patient, explaining when to prescribe additional medications, showing the student where to observe the jugular vein. So first one is regarding examination methods. How means methods. Examinations, teaching the student how to examine the patient. So examination, explaining when to prescribe additional medications. So second one is medications. First one is examination, second one is medications, third one is jugular vein. Jugular vein, showing the student where to observe the jugular vein. So first one is examination, second one is medications, third one is jugular vein. So focus on these things. Focus on these three things. Right. Thunderbolt 8. Yeah. And the audio is here, second part. Two audios. I should have cut it, but I did not have time to do all those things. So now I'm taking this. Yeah. So yeah. Now let us see.
In the next few hours. The outlook is very good in most cases. We're going to give you antibiotics and fluids, but there is a small risk of the infection returning in the future.
You hear a medical student talking to a senior resident about assessing a patient.
I understand that Mr. Frederick has chronic heart failure, and that we're concerned with volume overload if he doesn't adequately excrete enough fluid. But how do we determine his volume status and whether or not he needs diuretic medications?
That is a good question. So there are several ways we can assess volume status. First, we can perform a physical examination on the patient. What would we be looking for?
Well, we can assess for peripheral edema. We would look at the patient's hands and feet to assess swelling and determine whether or not there is pitting.
Yes, very good. We can also assess for jugular venous pressure. This is most easily done by having the patient lay at a 45-degree incline and then observing his external jugular vein. The filling level of the jugular vein should be less than 3 centimetres above the sternal angle.
Yeah. So now let us check the answer. Yeah. So first second, I asked you to write your name. I don't think he's there now. Yes. Okay. Dr. Naresh is here. Yeah, Dr. Naresh. Very good. Don't miss. So, Thunderbolt. We have finished 8 questions so far. The fastest session ever. Okay. So Thunderbolt 8. Yes, submit your answers. Yes, 8, 7, 6, 5, 4, 3, 2, 1. Submit. Yeah. Thunderbolt 8. All right. So 3A, 4C, 5C, 6C, 7th one was A. That was what we have done. 7th one was A, and 8th one is A. 8th one is A. 8th one is A. Yes. 8th one is A. Yes. Update scores, please. Update scores, please. Yeah. Here it is. 384 Thunderbolt A, B, C. Yes. So the answer is A. Okay, those who have submitted the answer, you can go here and you can just and click on the button. Tick the button. Okay, just buttons. There are 3 buttons here, A, B, C, whichever you have done, you can give it there. Okay, please. Okay, right. So we have seen 8 questions so far. 8 questions so far. Okay. Now, yes. So 9, 10, 11, 11 questions are there. 9, 10, and 11. 11 questions are there. So 3 more questions are there. Okay, Simon sir is hungry. He has to eat something. It's already 4:30. Okay. Madam has come here. Okay. My family is here, so I have to just go for once and just check out what they are doing. And I'll get back after my lunch. So I'll explain these questions later, and 3 more questions are there. And after the lunch, shall we go for reading or continue with listening? Reading, okay, listening or reading. Yeah. Give me your option after lunch. What shall we do? Reading or listening? Come on, fast. Listening or reading? Yeah, listening explanation I'll give, nah? I'll give later, no problem. I'll give you all the explanation. Yes, I'm just asking your opinions. All of you. And give your point. Then afterwards, give your feedback for the session. How was the session? Feedback for the session. Did you like it? How was the session? Okay, give your feedback for the session. I'm giving you just 1 minute. In 1 minute, you have to submit. In 1 minute, 8 questions we have done. Okay, normally we'll do 6, but we have done 8. 3 more questions are there. We'll do it later. So, come on. Give your feedback first. Yeah. So this is, yeah, welcome to the students. It's very good to see you all. I'm very much happy. So all of you, submit your feedback. I'm really happy with your participation. So if you're interested like this, we can arrange more sessions. Right, I'm in the main office here. So ground floor, I'm not in the classroom. on the ground floor office. Right. You can give your feedback and what more you like to have. Okay, you can just message there your interest, what more you like, what type of sessions you want. We are going to do more sessions, especially for the exam going students, 9th. Don't miss any session. I'll give you the link. Okay. Now, when I come back, I will not give the same link. I'll give you a new link. Okay. So do not miss the session. Right. Now, let me welcome the students who are there. So, new students. Tintu Jofin, only one Tintu Jofin new is there. Sakina Ahmed is there. Okay. Hello, Tintu Jofin. Yeah, Tintu Jofin, you can unmute and you can just tell me about where you are from, what is your profession, and about your experience with OET. If you're comfortable, you can share your points. How did you feel regarding the session? So it would be encouraging for us and the other students as well. If you can share your opinion on these classes. Next one, Sakina Ahmed. Hello, Sakina. So I'm allowing everyone to, one second. I'm allowing everyone to unmute. You can unmute again, Sakina. You tell me about yourself, your profession. You can unmute again. Sorry. I try to unmute everyone. So you can unmute once again.
Hello.
Yeah.
Good
Yeah. You can share your, what is your name, your profession, where are you from?
My name is Sakina Ahmed. I am a registered nurse from Pakistan. The way of your explanation is wonderful. Really, we accept the answer is very easy. Thank you so much for your precious time and care. Thank you so much.
Yeah, thank you very much. Yeah, once again, Tintu Jofin. You can share your experience. Okay. Next, Dr. Swati Nemade. Dr. Swati Nemade. Share your
Yes, sir.
experience. How was
It's
that?
useful, sir. Yes, sir. The sessions are useful, sir.
Okay, what did you learn? Okay, Dr. Rani. Dr. Rani, by the time I called her, she left. Huh? Okay, fine. That's fine. So we'll join again shortly. So that's really great. Have a nice day. Bye-bye. So, so for the students, if anybody is interested in our regular sessions, here we are. This is our contact details. You can just check on this one. Our WhatsApp number is 91. Okay, that is India code 9877867360. The last 10 numbers 9877867360. This is our contact number. You can contact here. So, Grandmaster class.